Hi everyone, welcome back to Dr. Class Med Corner. Today we are going to start the part 5 of our clinical case scenario series. So let's begin. So here we have the MCQ number 21. A patient demonstrates loss of muscle strength in all four extremities due to the spinal cord injury. So which of the following is accurately derived from the findings? Option A, the injury in the spinal cord involved the first lumbar segment. Option B, the patient's abdominal muscle strength is intact. Option C, the injury involved the segment below the first thoracic spinal nerve. Option D, the injury involves one of the cervical spine nerves. And the correct answer is option D. The injury involves one of the cervical spine nerves. So let's see the explanation. A patient with a tetraplegia most likely have an injury that affecting the cervical spinal nerves. In addition to the paralysis of the four extremities, the abdominal muscles are also affected, causing the weakness in the breathing and inability to cough effectively. An injury involving a thoracic segment caused the paraplegia. Next, we have the MCQ number 22. A patient who complains of fatigue, difficulty in swallowing, and the weakness is diagnosed with the myasthenia gravis. The physical therapist who is teaching the patient with the various conservation method understands that this condition is most likely caused by which of the following? Option A, insufficient secretion of the acetylcholine. Option B, insufficient dopamine level. Option C, demyelination of the neurons. And the option D, inflammation of the arachnoid and the pia mater of the central nervous system. And the correct answer is option A, insufficient secretion of the acetylcholine. So let's see the explanation. Myasthenia gravis is caused by the insufficient secretion of the acetylcholine, which causes a defect in the transmission of the signals at the myoneural junction. In the case of Parkinson's disease, that is caused by the insufficient secretion of the dopamine levels, causing the dysfunction of the extrapyramidal system. And the cause of the multiple sclerosis is unknown, but its development is thought to be influenced by the autoimmune disease, as multiple sclerosis symptoms are caused by the demyelination of the neurons. Let's jump to the MCQ number 23. The shoulder is the most mobile joint in the body, but because of the wide range of the movement, it is one of the most commonly injured joints. The shoulder consists of the humerus, glenoid, scapula, clavicle, acromion, and the four other joints. So which of the following is the most commonly dislocated joint in the shoulder? Option A, acromoclavicular joint. Option B, sternoclavicular joint. Option C, scapulothoracic joint. And the option D, glenohumeral joint. And the correct answer is option D, glenohumeral joint. And the explanation we have, the glenohumeral joint is the most commonly injured joint in the body. This joint consists of the capsular and ligamentous constraints that surround the musculature and the glenoid labrum. So because of the leak of the bone stability, the glenohumeral joint is at increased risk of injuries. So let's see the MCQ number 24. A 28-year-old woman at the 12th week of the gestation is informed what to expect during the labor and delivery, as the patient is diagnosed with a spinal cord injury that affecting T11. The patient is informed that the following is the most likely to occur during the birth, except option A, a painful birth. Option B, ineffective uterine contractions. Option C, autonomic hyperreflexia. Option D, abnormal progression of the labor. And the correct answer is option C, autonomic hyperreflexia. Let's see the explanation. Autonomic hyperreflexia and the concomitant uterine contractions occur in women with spinal cord injury above T6. In the case of spinal cord injury above T10, effective uterine contractions are normal and labor progression is expected because the efferent innervations of the uterus arises from the T10 to L1. So the labor is painless for the woman with spinal cord injury above T10. So let's see the last MCQ of this video. The cardiovascular system and the pulmonary system shows the most significant changes in response to increased activity or inactivity. A patient referred for an exercise program is expected to demonstrate which of the following as a normal response to exercise. So the option A, decreased systolic blood pressure. Option B, decreased cardiac output. Option C, increased peripheral vascular resistance. And the option D, increased tidal volume. And the correct answer is option D, increased tidal volume. So let's see the explanation. Increased tidal volume is the normal response to exercise. Tidal volume is the volume of air breathed in and breathed out during the quiet respiration, as peripheral resistance decreases with exercise. So the systolic blood pressure and the cardiac output increase with exercise. So that's all for today. We will discuss the further scenario-based MCQs in our upcoming part of this series. So stay tuned and thanks for watching.